Always think ahead before moving any sort of load, whether big or small. Ensure the route is clear. Plan where you're going and use mechanical aids where possible. If you have to lift manually, examine the object for size, shape and weight. You can assess the weight by raising one side an inch or two. There are certain areas that you should be mindful of when lifting anything. The first area is your balance circle. Your balance circle is the area around your body in which all lifting, pushing and pulling should be undertaken to minimize the risk of injury. To define your balance circle, just draw an imaginary perfect circle on the ground with your feet defining the size and position of the circle. Naturally, if your feet are together, the balance circle is a lot smaller than if your feet were apart. When you're pushing, pulling or lifting outside this circle, you're placing greater strain on your back than you would be if you kept the load within the circle. To achieve optimum balance, statistics show that, in most cases, it's better to employ a staggered wide stance than a narrow stance or even a wide stance. The best way to discover your optimum stance is to have a colleague try and push you over while you experiment with different stances. Another key to preventing manual handling injuries is to maintain core strength and body stability, which, in other words, is the ability to maintain the correct alignment of the spine through body movement. This is achieved simply by maintaining strength in our abdominal muscles, which are the core stabilizing muscles. It should be remembered that it is not necessary to have the perfect set of abdominal muscles to prevent injury. We all have the same muscles, some just show theirs off more than others. How we address the load, whether it's a box, a bed, trolley or a patient, positioning the body to maintain balance is important as stabilizing the spine and contraction of the core stabilizing muscles. To experiment with contracting the core muscle group, make a short sudden movement with either upper limb and note how the core trunk muscles contract. It is this core trunk contraction that provides stability to and protection of the spine. When positioning the body, generally speaking, the front foot should be facing the direction of where the load is to be moved to, with one foot slightly forward of the other. The distance between the feet should be slightly wider than shoulder width. This allows a cantilever effect, providing for movement to be directed from and through the thigh muscles. Pelvic position should remain static through all movement phases. The back should be positioned to maintain normal spinal curvature. All movement should be directed through and from the thigh muscles, remembering not to twist during the movement. Try to maintain a position where the pelvis remains aligned with the shoulders to avoid twisting injuries. Before lifting anything, consider the environment, the equipment, correct lifting techniques, load, communication, and limitations. Each assessment should be directed to reducing the risk of injury. Keep arms close to the body and tucked in. The best position and type of grip depends on the circumstances and individual preference. A hook grip is less tiring than keeping the fingers straight. Where possible, place one hand below the object and the other at the opposite corner. If you need to vary the grip as the lift proceeds, do it as smoothly as possible. Use your leg muscles to lift the load and tighten your back and stomach muscles as you lift. Lift smoothly, keeping the load under control. Do not jerk or twist. A few simple tips to help you protect your musculoskeletal system.